So usually when these protocols are put together by CDC, and I looked at them very carefully, they have taken into consideration churches and synagogues. Uh, I do not believe that the state requirements have taken an in-depth look on in terms of how mosques or masjids operate. Okay, we do not open up once a week. We do not sit on a pew. We do not usually. I mean, most of these churches are never fully packed. If they are, that's very good, but most of them are not. Uh, we are standing shoulder to shoulder. We are sharing some very, very, very close space together. I do not think that the protocols that apply to religious institutions have taken, again, a serious look at how mosques operate. We have to think very carefully in terms of how we are going to take care of our population and operate in a very safe and effective way. So I feel very strongly that outdoor praying is much better than indoor praying because in terms of the work that I do, in terms of the data that is there, in terms of the experience that I personally have, I've seen more people who were working indoors with people that they did not know, obviously, or some other, some non-member of a family, they had a much higher chance of acquiring the disease, right? If there's a prayer 6 feet apart, that's ideal. I do not feel, even in phase 3, that children should be allowed in the mosque at this particular point. I think it should be an adult only. Let's wait a little bit. As you can see, yes, in Virginia the numbers have gone down, but do you believe or do you think that if the numbers are going up in other states, it's not going to affect Virginia at some point? I believe it's going to affect Virginia also. So let's be careful, right? Let's make sure that we have doors that we don't have to touch when we open them.
Mhm.
If we keep the doors open, and there should be one entry point and one exit point. It should not be that you enter and exit from the same place. If that's a touchless doors or keep doors open, that would be ideal. We have to consider, compared to churches and synagogues, that we've got to go and do wudu, right? We have to, that's another area where you're in close proximity to each other. So we've got to be very careful because these standard guidelines, I honestly do not believe perfectly fit a Muslim religious organization. So I would wait right now to relax, and open up completely. I would have limitations on a number of people coming to the mosque. And to be honest about it, I miss going to Adams, which is nearby my home in Sterling, and listening to Imam Majid. I mean, he was a dear, dear friend and a mentor, and I feel very strongly that he's a great leader in our society. Uh, I miss that. So online, I mean, I go online and look it up, and my kids do the same thing, and it's not that. So inshallah, Allah subhanahu wa ta'ala is not going anywhere. Inshallah, the masajid are not going anywhere. One of the things that we all know, and I mean, and sometimes I get into trouble, but I'll go ahead and say it, is that Allah subhanahu wa ta'ala has always said that I didn't create you so that you pray. You mean I have enough angels who pray for me or pray to me, right? Uh, let's pray at home if possible. Uh, Try to minimize the exposure so that we do not bring the disease back home. If we do it with social distancing. We're doing wearing masks. Do not forget to wear a mask. Masks should be mandatory, and anybody not wearing a mask inside a mosque should not be allowed inside the mosque. And I feel very strongly about that. If one of the things that you have to do is you got to make sure that everybody does wudu at home and not come inside and do wudu over there. That's not such a big deal. Making sure that you observe somebody else's space, right? And if you can bring your own mat, bring your own musalla, that would be ideal because the CDC guideline says that after every service you've got to sanitize and clean up, right?
Mhm.
Think about the practicality of it at a mosque 5 times a day. that's going to be a nightmare. That's going to be impossible to do, right? Even if we try, it's going to be very difficult. And then there are mats and there are carpets. So let's bring our own mats over there. That should be something mandatory. And believe it or not, every single household, every single Muslim has their own mat. So those are the common baseline common sense things that we should do. And obviously, serving of food should be minimum at mosque. Remember that if you serve food, make sure that it's done in a way that it's not communal. I mean, a lot of people putting their hands or spoons or whatever it is and serving themselves. There should be somebody who serves the food. Right now, 250 people are allowed for weddings or funerals. But again, if you go and do that, wear a mask. Try to do it quickly. I went to a funeral. Was it yesterday? Yes, and we did it very quickly. It was in Sterling at the Sterling Cemetery, and everybody was wearing a mask. 80% of the people that came to that funeral were all physicians, and being very careful and cautious. Nobody hugged, nobody shook hands. I missed that, you know. But let's be careful. And this is not the first time in the Islamic history that something like this has happened, right? So about 1,000 years ago, Ibn Sina, when the Black Plague hit the city, said we've got to quarantine ourselves. We've got to close down everything, and this is what we've got to do. And they observed, and he was the first one who established a 14-day guideline for isolation and quarantine. So let's learn from all of our those giants that we've had, and try to put the right science. Subhanahu wa ta'ala has given us the brain, and that's why has given us the opportunity to think, right? And we still are missing one of the greatest things that we used to have in the past, and that is the science part of it. So let's use that. Let's follow the guidelines that the scientists are telling you, the public health folks are telling you. Look at the numbers and data, and just be logical. Look at the numbers, for God's sake. And I don't know what's happening to the country. People are not looking at their numbers. Don't you want to protect yourself and your family? Do you want to put them in harm's way? Would you want your child to, ride a motorcycle without a helmet and smoke a cigar at the same time? No, you don't want that. Do you want your child to do something really dangerous? Well, the virus is still out there. So let's be careful.